I will be talking about yeses, trend of yeses. I heard, my neighbor told me, my friend told me, I saw, it's trending, and all of that. So basically, yeses. That's what this pharmacist insight is about. A lot of times when you are going through something, you first tell your friend that, oh, I'm feeling this particular type of way. I'm tired. I've been lethargic this past few days. I've been sluggish. I'm having headache, and I don't know what's wrong with me. Or it's even something like, oh, my back is paining me, oh, my leg is paining me, oh, my bone. I don't know. It just feels like my bone is stiff these days. My waist has been stiff. If I should bend down, this is what is wrong with me. I can't bend down well, and all of that. So you just tell your friend and divulge particular things that you are going through to them. And at that point, your friend is like, that was how I was feeling to that day. Oh, that was how I was feeling to that day. And this is what I used. This is what I did, and it worked. And your friend gives you the drug they use, or they even tell you to go and buy. This is the drug I bought to, and it really worked. And you actually go and buy it. And because it's an over-the-counter drug, drugs that can be sold over the counter without prescription and all of that, it is sold to you, and you use it. And it's possible that yes, the drug did work for you, but you're experiencing relapse. That thing is recurring again, and you're like, what exactly is wrong? My friend said they use this, but it's worked though, but this thing has come back again. What exactly wrong? So yes. That your friend said does not mean you should not confirm. So it's possible, yes, it's good to hear what your friend says, what your neighbor said, or what you saw online. But as you've heard, always confirm from your healthcare professionals, from your pharmacist, from your doctor, before you proceed to do this, because there is what we call clerking, yes, whereby we clerk you. Clerking basically means asking you questions. So there are some things that you have, underlying issues that you probably have that your friend does not have. And when they use the drug, because they don't have the underlying issue, the drug works for them. But you have underlying issue, or is you probably don't have underlying issue, but you have family issue of a particular thing. So instead of us addressing the fact that okay, there is this family history, but because you bought what your friend used, we are not able to address it. And if care is not taken, so situations like that can escalate, whereby you have to now then deeply and heavily treat. But if you had complained rightly, would have detected that early and refer you to the appropriate departments that you need to go through. And so when your friend tells you something, or your neighbor, anyone around you tells you to do something, and you come to purchase it, or you go for your next clinical appointment, it's always good to confirm from your healthcare professional, from your pharmacist, from your doctor, that okay, can I use this particular thing? This is what I've been experiencing, and my friend said I should get this. So based on that, we can then advise you that oh yes, what they told you to get is actually right. So yes, you can get it. Okay, but do you have so and so um illness, or did you used to have? So for example, let's take something as common as ulcer. So maybe it's the pain relief you can get, and maybe the pain relief your friend told you to use is like ibuprofen and NSAID or Felvin, that's peroxicam. And your friend does not have ulcer, does not have issue of ulcer, no family issue of ulcer. But you, on the other hand, and your friend does not know that okay, ulcer patients are not meant to use NSAIDs. But you, on the other hand, you came and you decided to come and buy that exact thing, and you have issue of ulcer, or you probably have family issue of ulcer, like that means someone in your lineage used to have ulcer, or even have risk factors, other risk factors that can trigger ulcer in you, and you come to buy a drug that induces ulcer, and the drug works, but it caused another thing. So in that kind of situation, yes, your friend told you to, but because you did not further, know, and you also, your friend told you to come and get something, and they even asked you that okay, this you have ulcer. You might say no because in your mind you be like, I fed not, no, I used to have, or you even say it's go for that now ulcer. I usually eat very well, so you use ibuprofen and it induced ulcer in you. So like these are things that us asking you questions do. So I'm going to bring it down to a case study situation. I presented on cataract at my workplace. While presenting on that, I spoke about the fact that cataracts is basically the clouding of your lens. Yes, your eye lens, clouding of that eye lens. So you are experiencing impaired vision. You're not able to see because you are seeing things in a cloudy way. So, and some of the risk factors is diabetes, long-term use of corticosteroids, age, family history, and things like that. These are like risk factors that can lead to cataract. There's something we do when we present, we always do a case study. So basically, case study is just trying to like this particular thing that we presented on, how can we apply it to our profession, to the sector that we are in. Dexamethasone is a corticosteroid, and like I said, corticosteroid is a risk factor. Long-term use of corticosteroids is a risk factor of cataract. Imagine someone now telling you to purchase dexamethasone for weight gain. First off, dexamethasone is not indicated for weight gain, but a lot of times people purchase some drugs not for the main use of the drug, but for the side effects. Weight gain is a side effect of dexamethasone. If this drug is not used for this particular thing, it is not used. Side effect means side effect, like alternative effect, an effect by the side. So, and this particular drug, dexamethasone, is not indicated for that particular use. So you're not even using it for the right thing. It also has an effect that in long term is not good for your body at all. There are people who they actually need the corticosteroid, but what we call risk to benefit ratio. To know that okay, the benefits of this drug does it outweigh the risks that this patient will face. That's for somebody that actually even needs the drug really. So we usually check that. Now imagine someone that you're never using the drug for the right use, but what the drug is for exactly. So at that point, you don't even we don't need to do a risk benefit ratio to know whether you need to continue the drug. You just need to stop because, like I said, there are some. Because one of the case study I did was on the fact that a elderly woman, yes, around I think 61 or 60 years old, she was diagnosed with type 2 diabetes and she's on long-term use of corticosteroids for her rheumatoid arthritis, for her arthritis. And so I then broke down the risk factor. Risk factor being the fact that she's already old, like she's already above 60, she has diabetes, and she's now on corticosteroids. So there are those three risk factors. Is already an indication that cataract is around the corner, and so that was what the case study was about. So for that kind of patient now, there is now the risk benefit ratio to see that does this patient need to continue the use of this corticosteroid, or the patient will use another therapy for to manage this condition. So I'm just here to let you know that when you hear that you should use a particular thing, or your friend tell you, or even see it online, or somebody said it worked for them, it's not a go ahead for you to go and use that particular same thing. You need to confirm from your pharmacist, your doctor, to your nutritionist, your dietitian, to know your dermatologist, yes, to know if you need to use this particular drug or not. So there is even something deeper in pharmacy where we call it pharmacogenetics. Pharmacogenetics is when we use your genes, we test your genes with a particular round of therapy so you know which drug exactly will benefit you better. And that's something deeper. So there are things like that. There is the effect of your gene, there is the effect of family history, effect of medical history, your medication history too. Some medications you've used in the past, maybe you don't need to, maybe if you use this particular drug, that effect of the past medication can affect this drug. Or the fact that you've used it before and you experience this particular thing and you're trying to use it again. So always confirm from your healthcare professionals when you hear, when you see that okay, you have to use a particular thing.